Hello friends, welcome to SK Homeopathy Academy and myself Dr. Vidhavati Gupte. I am MD Organon and PhD Organon. So today we are going to talk about the important topics that are asked in AIAPGET exam, and we are later going to focus on each and every topic in that. So in recent AIAPGET homeopathy papers, homeopathic philosophy and Organon together contributed around 16 questions. Okay, 16 questions means one question is of 4 marks and 16 questions, hence almost out of 120 questions, 16 questions were of Organon and it covered up to 64 marks. Okay, therefore you have to be very well prepared with Organon of Medicine while giving this exam. Okay, so first is aphorisms, which is covering almost around 45 to 50%. It means that there are going to be compulsory 3 to 5 questions on aphorisms that are going to be asked in exam. Okay, so what are the important aphorisms that are asked is 1, 2, 3, 6, 7, 9, 26, 27, 29, 72 to 82, 83 to 104, 105 to 145, and 246 to 248. So almost everything is covered in aphorisms in our exams. So you have to be very well prepared for this. Okay. So how you're going to study this? You're going to study in a comparative form. Next is different editions of Organon. It is going to comprise of 10 to 15%, means almost 2 questions are going to be asked on this. So what is what are the changes that has been seen in different editions? They're going to ask you questions on 6th edition about elempotency, and also what are the aphorism changes that has been occurred, who has translated which book, what was the name of certain books. Okay, everything such kind of questions are going to be asked in different editions. Next is vital force. 5 to 8% of the questions may be asked in this. In this, there is going to be dynamic concept of disease, which is we will cover in aphorism 9. Then there is going to be chronic disease and miasms. It is going to cover up to 8 to 10%. Means it is compulsory going to have 2 questions of this. So what are these? Psora, psychosis, syphilis, and what are mixed miasm? How you're going to treat it? How you're going to diagnose which kind of miasm is there? Next is drug proving. It is going to consist of 5 to 7%. So either 1 or 2 questions can be asked in this. What are the types of drug proving? What is the importance? And how is prover selected in homeopathy for drug proving can be asked. Next is susceptibility. 8 to 10%. Again, it means 2 to 3 questions can be asked from drug proving. In this, what is minimum dose, repetition, and what is second prescription can be asked. Next is case taking. 5 to 7% means one question is going to be there. More than one person can also be there. So what is it? Aphorism 83 to 104, and what are the qualities of the physician that are required for case taking? That is freedom from prejudice, unprejudiced observer. He should have a sound sense and fidelity in facing the picture of disease. Next is totality and individualization. Again, it is covering 5 to 7%. In this, characteristic, general, and mental symptoms can be asked. Then we have Kent's philosophy, Robert's philosophy, Swartwood's philosophy. Okay, so this carries 10 to 12% and it carries 5 to 8%. So you have to be very well prepared with Kent's philosophy, as 1 or 2 questions are going to be asked from this. Okay, so what are the main important questions that are asked in this is Kent's 12 observation, suppression, and cure, and also other things are also asked. And in this, Robert and Stuart clause, constitutional prescribing and symptoms evaluations can be asked. So come prepared, and we will guide you for this, and stay with us.